Okay, assalamu alaikum.
Alaikum salam.
Good afternoon, everybody. Thank you for organizer to invite me for this presentation. It's first time for me to have this experience to present a webinar, and I hope the situation which we have it now globally, it will be faded out soon. The presentation which I am going to present it now, it's about BPH and Rezum. It's one of the new options to treat prostate, and in Qatar and HMC, we have the opportunity to try it. I will share with you our initial experience because for the current situation of COVID pandemic, we could not continue our study. But we follow the patients, some of them up to 3 months. So first of all, I have no conflict or interest to declare. This is Qatar Islamic Museum. Here we have it in Qatar. Inshallah, you will visit us in the future and you will see it. So BPH is a common urological condition characterized by progressive increase in the size of prostate gland. It's a disease of aging. So if you are 50 years old, you have the chance of 40% to have lower urinary tract symptoms. And if you are 90, you have almost like 90%. In large proportion of BPH patients, prostate enlargement causes bladder outflow obstruction, which results in LUTS. And of course, because mainly the increasing in size in transition zone, and it can affect the outflow and urethra. So this is an example of normal prostate and prostate with the BPH. With the progression of a prostate, BPH can lead to decreased quality of life. It can lead to back pressure and renal damage. A patient can have recurrent infection, bladder calculi, and retention of urine. So International Prostate Symptoms Score, it's a nice tool. We use it as a baseline assessment of symptom severity in men with LUTS. And it's also a good tool to use it for progression and in follow-up period. So it can classify the patient to mild, moderate, and severe. And I'm sure that all of you are familiar with this type of a question in IBSS. So the workup of BPH here, usually we start with history, digital rectal examination, urine analysis, PSA in selected patient, IBS score, and Euroflow and BVR. And then we can, based on the severity of the symptoms, we can offer the patient either watchful waiting, medical therapy, minimal invasive surgery. And if you are planning to go for surgery, it's advised to have pressure flow, cystoscopy, and prostate ultrasound before you proceed. So we have like almost 3 options for the treatment. We have watchful waiting, medication, and surgery. Behavior therapy and self-management, it's a good option for the treatment of the patient. I found a lot of patients, they start on behavior therapy without anybody telling them, like double voiding, bladder training, or timed voiding. Avoid some substances that can exacerbate symptoms like decongestant, pseudoephedrine, and weight reduction or fat burner symptoms and diet supplements like ephedra. Of course, caffeine, alcohol, spicy food, and acidic food that can exacerbate the symptoms. Nocturia can be reduced by decreasing fluid intake in the evening, avoid diuretics in the evening, and for lower extremity edema, elevate their legs for 1 hour before bedtime or consider compression stocking. So for medical therapy, we have 2 organs to be tackled. We have a bladder. We use anticholinergic to relax the bladder muscle, or in the prostate, we have either 5-alpha reductase inhibitor to shrink the prostate, or alpha blocker to relax the prostate and the bladder neck. So alpha blocker is the relaxation of a smooth muscle in the bladder neck prostate. It's not decrease the prostate volume, and there is a risk of progression. And there are 3 types of alpha-1 subtypes, like alpha-1A, which is cause the relaxation of a smooth muscle of the prostate, bladder neck, seminal vesicle, and vas deferens, and can lead to anejaculation or retrograde ejaculation. And it's the subtypes in the prostate. Alpha-1B, it's located in the blood vessel and can cause hypotension. Alpha-1D, it's mainly in the nasal passage and can cause nasal congestion. For medical therapy, which is commonly used now, we have alpha-sucin, tamsulosin, and silodosin, and it have almost like equivalent clinical efficacy. It's decreased IBS score by 4 to 6 points, and increased bladder capacity, decreased detrusor overactivity, and increase Qmax 20 to 25%. Improvements in LUTS about 4 to 5 days after start of treatment, and typically not affecting libido, but are associated with retrograde ejaculation. Most common side effects is dizziness. For 5-alpha reductase inhibitor, we have finasteride and dutasteride. There is an improvement directly attributed to a decrease in prostate size in patients who are treated with 5-alpha reductase for at least 3 months. 5-alpha reductase prevents the conversion of testosterone to dihydrotestosterone, which results in apostosis of epithelial cell and leads to a reduction in prostate size. Benefits evident at 4 to 6 weeks, maximum efficacy from 3 to 6 months, and IBS score reduction in 15 to 30%, decreased in prostate volumes for about 30%, increase Qmax 2 mil per second, approximately like 10% improvement, reduce refractory hematuria due to BPH. Tadalafil or Cialis, it has also a mechanism of upregulating nitrous oxide and cyclic adenosine monophosphate activity in smooth muscle tension in the prostatic stroma and capsules. It reduces inflammation and increase pelvic perfusion and reducing ischemia. It's mainly used for erectile dysfunction. In my own practice, I use it as a monotherapy if the patient has mild LUTS and erectile dysfunction as well. For anticholinergic, it's decrease contractility and relieve irritative symptoms. Patients who don't have an elevated BVR volume and whose LUTS are primarily the irritative symptoms. Of course, it has the adverse effects. It can cause blurred vision, tachycardia, urinary retention, confusion, constipation, and dry mouth. Surgery is recommended for patients who have renal insufficiency secondary to BPH, refractory urinary retention secondary to BPH, recurrent UTI, recurrent bladder stone or gross hematuria due to BPH, or patient unwilling to use other therapy. He don't want to be in medical therapy. A clinician should not perform surgery for asymptomatic bladder diverticulum according to AUA guidelines. So in minimal invasive surgical options, we have so many types now. I remember when I start my training, my senior consultant said, you are lucky because you are seeing now the TURB. In 70s, 60s, they have only open surgery. But now I am telling the new resident, you are lucky because you have so many options for treating the prostate. So for minimally invasive surgical options, we have ablations, which is laser, tuna, transurethral microwave therapy, Rezum, aqua ablation, and injections. Vaporization, we have laser and transurethral vaporization. Resection, we have laser and bipolar and transurethral incision of the prostate. Inoculation, we have laser and bipolar inoculation. Mechanical, we have urolift and stents, and embolization. In my talk today, I will talk about Rezum, which is a water vapor thermal therapy. The Rezum system is intended to relieve symptoms, obstruction, and reduce prostate tissue associated with benign prostatic hyperplasia. It's indicated for men for 50 years and above with a prostate volume 30 ml to 80 ml. The Rezum system is also indicated for treatment of prostate with hyperplasia of the central zone or median loop, offered to eligible patients who desire preservation of erectile and ejaculatory function as a conditional recommendation. Rezum system uses the principles of convective heat transfer that exploits the thermodynamic properties of water. The system compromises a radio frequency generator and a single-use transurethral delivery device, which incorporates a standard 4 mm 30-degree cystoscopy lens. Water vapor is delivered through retractable vapor needle via emitter holes in the transurethral devices. Gadolinium MRI and histological testing post-procedure have demonstrated that Rezum system to be successful at producing necrosis in target cell tissue while preserving non-treated tissue around the area. So the benefits of Rezum system, potential alternative to BPH medications, to provide noticeable symptoms improvement within 2 weeks, does not require general anesthesia, preserve sexual and urinary function. It's allow patient to return to regular activity within days. The total time taking, it's about 2 hours for the visit in the outpatients. The procedure by itself, it's only 5 minutes, and the injection of the needle take about 9 to 10 seconds for each injection. Patient may have a catheter, but in my practice, actually all patients, I insert catheter for them. Rapid return to normal activities. We give oral medication 1 hour before the procedure and local anesthesia at the time of the procedure. So the advantage of this system can be performed under sedation only. It's a day case procedure. Strong short-term safety profile. No report of de novo sexual dysfunction. It is suitable for patients with an obstructing median lobe. Short procedure time. Good improvement in subjective and objective outcome measure like IBS score, quality of life, Qmax, and post-voiding residual urine, and it's cost effective. And relative disadvantage, it's limited long-term data available. Patient with urinary retention is excluded. However, in our study, we have 2 patients with long-term Follis catheter. Not suitable for patients with a history of recurrent urinary tract infection because it can increase the risk of infection post-procedure. Not suitable for large prostate, more than 120 cc. However, we have 2 patients, one of them 120 and the other one 140 cc in our study. Not suitable for patients if prior invasive procedure for treatment for prostate or patient who had radiotherapy. More than 50% of patients require catheter post-procedure. So at HMC, we were the first to utilize Rezum in our region. First case done in November 2019. Total number of patients we did 30 till now. All are planned for regular follow-up at first 1 month and 3 months and 12 months. Delayed and incomplete follow-up visit due to COVID-19 pandemic situation. When COVID pandemic hits, we plan to resume where we stopped and publish our data. So all of our procedures were done in outpatient setting under local anesthesia. When I start to do this procedure, I use truss block, and then I moved to pudendal block. I found it's more convenient for patients, lower risk of infection, and has better anesthesia effect. We use also paracetamol, diclofenac, sodium, and morphine. It's ideally the prostate size should be less than 100 grams, but we did 2 cases where the size was larger. One patient was 140 and the other one 120 grams, and the results were promising. Of course, you need to do urine culture before the procedure to exclude UTI. So the mean age was 65, prostate size mean was 55, Qmax before the procedure mean was 8, and IBS score was 22. 17 patients showed to their follow-up appointment at 1 month and still to be followed at 3 and 12 months. 13 patients are delayed due to COVID pandemic situation. And at 1 month, the mean Qmax for 17 patients were 19, and improvement were 100% for all patients. IBS score mean 10, and IBS reduction 54%. Side effect dysuria, and 3 patients were complaining of perineal pain, but this we noticed in almost most of the patients, they're complaining from dysuria, but it subside markedly after 2 weeks from the procedure. 1 patient admitted to the hospital because of urosepsis, and that patient had long-term Follis catheter before procedure. And after we treat him, we remove the Follis catheter 3 weeks after the procedure, and he's voiding freely. At 3 months follow-up, Qmax, the mean was 18, and IBS scores the same, mean like 10. Dysuria, 1 patient complained of dysuria at 3 months. And partial retrograde ejaculation, we noticed that in 2 patients that they said the volume of ejaculation is less. So average procedure time for 30 patients was 5 minutes. All patients are off their prostate medication after 1 month from the procedure. Dysuria is the most common symptoms post-op, virtually in all patients, and to improve with the time. As I said earlier, after 2 weeks, we noticed marked improvement in dysuria. So in conclusion, the Rezum procedure is a novel, minimally invasive therapy for treating BPH. Data from available studies point toward good clinical outcome with a short-term risk of self-limiting minor complications. Its application has demonstrated clinical effectiveness and poses specific benefits that distinguish it among other treatments. It is applicable to outpatient setting. It's effective in preserving sexual function and is versatile in its ability to treat variety of prostate gland morphologies. At HMC, we are planning to go for further applying and studying Rezum and its application in our practice after we are done with the COVID pandemic situation. Thank you.